Today, we celebrate 30 years of grant making, 30 years of progress, of partners, of people and communities coming together with one incredible mission to improve the health of all Kansans. It's 1985. The Kansas City Royals win the World Series. Artists come together to record We Are the World. Microsoft releases its first version of Windows. And in Wichita, Kansas, the nonprofit Wesley Medical Center sells to Hospital Corporation of America. To date, it's the highest price ever paid per bed for an American nonprofit hospital. The proceeds from the sale form the endowment still core to our grant making. And in our early years, grant making focuses on biomedical research, rural health, the elderly, and health professions. A movement begins. From the beginning, we knew two key things would be critical to meet the vast needs of Kansans: partnerships and listening for great ideas. We host 40 meetings across the state, and we learn what Kansans feel they need most. It's everything from affordable, available, and accessible healthcare to the resources and leadership that could provide that care. As we hone our practice of listening and learning from Kansas communities, we turn our focus from research to prevention and public health to more directly impact the day-to-day lives of Kansans. We work to identify the state's most pressing needs, discerning which partners or initiatives can best help us progress in these areas. Key to that process is the creation of the KHF Leadership Institute, which continues annually for the next 15 years. As our work continues and we make large investments in prevention and public health, KHF identifies a gap in the availability of health data and research specific to Kansas. To address this void, KHF creates the Kansas Health Institute, an organization which becomes one of the premier state-based health policy forums in the country. Just as important as the major investments we're making for statewide initiatives and organizations, we also launched two major community-based efforts. GROW, or Giving Resources to Our World, is the matching grant program helping community foundations increase endowments, capacity, and resources for years to come. And the Kansas Community Leadership Initiative provides skills and training to future leaders in 40 Kansas communities. As the new millennium dawns, there's a growing push to focus on systems change, not just individual change. This leads to funding at state universities and agencies, as well as working with the state's 100 local health departments to offer disaster preparedness, immunization, and public health prevention programs. We now realize the term health doesn't simply mean the absence of disease. It's also individuals rallying together in their communities through involvement, volunteerism, and staying informed on important issues. A prominent focus on civic health leads to stronger communities, better governance, and improvements in economic conditions and education. That core idea led KHF to create the Kansas Leadership Center to help people, systems, and organizations learn effective ways to foster leadership and innovation. But none of our program work would be possible without the years of good stewardship and fiscally responsible management of our endowment. These led in 2012 to a significant financial milestone. Since the organization's inception, we've distributed more than $500 million to Kansas nonprofit organizations and partners, and at the same time, grown our own assets to more than $500 million. The pressing health issues of Kansans continue to make headlines, and our state needs a place to come together to discuss new ideas and innovative solutions. We open the Kansas Leadership Center and Kansas Health Foundation Conference Center. More than just a building, it's constructed to be the living room of Kansas, and thousands of Kansans flock annually to the center. We share their passion for lasting impact, which is why we recently transitioned KHF from a private foundation into a public charity. This allows us more freedom to execute our primary strategies of policy advocacy, grant making, and strategic communications. We know the opportunity for health begins in our families, neighborhoods, schools, and jobs, and we are committed to making the foundation more relevant and impactful than ever. That's why we're focusing on civic health and health equity to guide our grant making, because we want to build a culture in which every Kansan can make healthy choices where they live, work, and play. The road ahead will present different challenges and new opportunities. But as we look toward our next 30 years, we are more steadfast than ever and our determination to create this culture of health in our state. Join us.